Hi, I'm Richard. I'm the pharmacist in charge. Can I help you with something today?
Hi, I'm looking for something to help go to the toilet.
Okay, and was this for yourself?
It's for my 3-year-old son,
Okay, that doesn't sound too good, but what was his name?
Dion.
Dion. Okay, now before I recommend something for Dion, can we go through a couple of questions about Dion's meals, Dion's bowel habits, etc., so I can make the correct recommendation for you?
Sure.
Yeah? Okay, now can you describe Dion's symptoms for me?
So he's not going to the toilet as often as he normally would,
Okay.
and he also complains that it's really hard to go.
Okay, and has he had these symptoms before?
No, he
No,
hasn't.
he hasn't.
Yeah.
And have you already tried something for this?
No, I thought I might take your advice first.
Okay. Now, can you describe to me how many times a day would Dion usually go to the toilet?
Around 5 to 6 times, yeah.
Okay, and how has that been recently? Like, how many times would he
He
go
hasn't
now?
gone to the toilet in 2 days, and so my husband and I are very worried.
Okay, is he your first child?
Yeah.
Yeah. It can be quite difficult, especially with the first one, and it can be very, very scary, I'll tell you. But now, can I just confirm with you? So he has difficulty passing stools, and it's actually quite painful as well, is it?
He has difficulty passing stools, but it's not painful at all.
Okay. And have you noticed any blood in his stools or anything like that? No. Okay. Now I know he's only 3, but does he have any other medical conditions that I should know about?
No, not at the moment, no.
No. Okay. So is he being prescribed any medications, like from the like a doctor's prescription, or does he take any over-the-counter medications, like the ones that you can grab off the like the pharmacy shelves? Is he taking anything like that?
No, he doesn't. No.
Any vitamins at all?
No.
Okay, so I'm just making sure that before I prescribe something that's not going to be possibly having any drug interactions or give any like side effects with something that he's already taking. Now, has there been any changes in his diet at all, or like, have you guys changed anything about his meals?
Yeah, he's been taking more protein lately because
Okay.
his grandmother's worried as he's not as big as other kids his age.
Oh, but, she's only looking out for her grandchild, isn't she?
Yeah, way too much.
Okay. Now, I promise this is going to be the last question, but does Dion have any other like known allergies at all?
No, he doesn't.
No. So it sounds like to me that Dion's actually having constipation, and that's nothing too serious to be worried about. Now, in terms of what's actually happening, is that because he's taking on a lot more proteins, a common side effect is constipation, and that's because we're not taking enough of our carbohydrates, or we're reducing our fiber intake, and when we reduce our fiber intake, like specifically, it actually causes constipation. Now, to help with this, I'm going to recommend this particular product. This is your Counselling oral drops. Now, this is for children, so it's perfect for Dion. Now, what's in it is the active ingredient is glycerol as well as sorbitol. Now, this will increase Dion's actual need to go to the toilet. Now, therefore, he can still continue with his diet, but be sure to compensate with a lot more fruits, veggies, grains, etc., so that he can still increase his fiber intake. Now, this does come in a chocolate flavor, which I hope he'll love.
He loves chocolate.
Yeah? Okay. That's good. Now, in terms of actually taking the drops, because he is 3 years old, in one dose, we recommend for him to be taking about 18 mils. Now, there is a syringe in the box in itself. Have you used a syringe before?
Yes, I have.
Do you want me to go through it at all? And
No,
how
it's
to use
alright.
it? Okay.
Yeah.
So once you've actually measured out 18 mils, you need to mix that in with, either a fruit juice or milk or something that he usually drinks. Preferably not water, because he'd probably still be able to taste it. But something like a juice would be great. And once you mix this through, just make sure he has the entire lot so that he takes his complete dose. Now, once you're done, make sure you put the cap on, as well as you wash out this syringe with just warm water. So that's in terms of how to actually use it. Do you have any worries or any questions up to now?
So how often should I use it?
How often? Okay, so you should take this 3 times a day, and you should do that till the symptoms are actually relieved. Now, it's a good idea to start at 8 a.m. in the morning, and then maybe at 1, and then maybe at 7, or usually when he takes his meals. Does he usually have like about 3 meals?
Yeah, I think with the meals would be easy to remember.
Yeah, exactly. So if that works for you, it's absolutely okay. Make sure you have it 3 times a day. Now, the instructions on how to use it, or if you have any other questions, I've actually printed out your consumer medication information leaflet.
Yeah.
And that will give you any of the extra details that you need to know if you're concerned and you just want to read up on something, and these are reliable sources as well. But be sure that if you start to see blood in his stools or it's black and tarry, make sure you go and see your GP or do give us a call, and we'll be able to guide you exactly on what to do with that.
Yep, sure, I'll do that.
Now, in terms of what you should do apart from all the medication is make sure you encourage Dion to go to the toilet when he feels it and make sure he's not holding it back. Make sure he has a regular routine in terms of, at certain times of the day, and make sure you give him, like, if he's into reward systems, like, the star charts, whatever makes him have a regular habit of going to the toilet. And make sure, again, a well-balanced diet, so that means his fruits, veggies, and like wholemeal bread will be great, just to replenish all those fibers. And also make sure you keep a tab on his bowel habits. So you're doing an absolutely great job. You notice that straight up. So whether it be that you're using a diary or whether you're using an app. So sometimes when you do go in to see a doctor, or like if you're coming back, then you have a sort of a record of exactly what's been happening.
Yep, sure, I'll do that.
Okay. So did you have any other questions for me?
No, thank you.
No? Okay, now I've thrown a lot of information at you. So just to see how well I did, can you tell me exactly how you're going to give these oral drops to Dion?
So you give the drops 3 times a day with juice or milk until the symptoms are relieved.
Yes. Do make sure that you only give about 80 mils in your one dose. And the 3 things to definitely remember is to encourage him to go to the toilet and make sure he's going to the toilet on a regular basis, so he has almost a routine. Mm-hmm. Again, the balanced diets of fruits, veggies, and grains, and do continue to keep tabs on his bowel habits. And the point for referral. So if you see, a blood, black or tarry stools, make sure you book an appointment with your GP as soon as you can.
Yep, sure.
Now, I've already printed out your information leaflet, and that's your product. So if you need any more information, again, feel free to go and have the extra reading. If, I've already gone through most of the information with you, but if things are still not sure about, do have a look at this.
Yep, thank you.
And now the symptoms should actually be clearing up in a couple of days or so, but if things don't, do come back to the pharmacy or even give us a call and we'll be able to help you out further. Yeah. And actually do say hi to Dion for me.
Yep, sure, will do. Thank you so much.
And Rachel will be able to help you out in the cash.
Thank you.